Every patient that I see, I approach their care as an individual. And what I mean by that is the same aneurysm in 3 individuals may have different answers for what we should do about that. And some of that comes down to how the patient feels, the patient's health, and the risks of intervening versus watching. And I try to bring that personalized care to every patient that I see and make sure that they understand the choices that we're going to make together, whether or not to proceed or to watch or how we're going to go about treating their issue. My name is Dan Calnan. I'm a neurosurgeon and the medical director of neurovascular surgery at Lancaster General Hospital here at Penn Medicine. My subspecialty is in cerebrovascular and endovascular surgery. That's operating on the blood vessels of the brain and disorders of those blood vessels. And the endovascular portion is going through the blood vessels to treat those conditions. So instead of doing brain surgery with a scalpel, we're using catheters to go up through the blood vessels and treat aneurysms, treat arteriovenous malformations, fistulas, life-threatening conditions. This is the way I explain it to my patients. Everyone's heard of a heart catheterization. Well, this is a brain catheterization. It's very similar, and it's a good way to explain it because oftentimes we harness what's been learned in the cardiovascular system to use within the brain. And the innovation is in its steepest part right now. All of the data that comes out now is giving us more opportunity to help people, extending the window to almost a limitless window that we can intervene to help people having strokes. And the innovation of the catheters that we use is allowing us to go further and further out the vascular tree to help people. It's a unique place to practice. It still has that feeling of a community hospital where you're taking care of people's family members that are there that you don't necessarily see in a big city. But at the same time, I have all the advantages of working for Penn Medicine with having access to state-of-the-art equipment, state-of-the-art tools, as I said, particularly for endovascular, where we're in that phase of development that I can harness those tools and bring them to LGH, or if needed, bring people up to Penn in the city in order to get them the best care that we can deliver.